Hello, welcome to Food Safety Fridays. My name is Simon Timpley from the International Food Safety and Quality Network. Today's topic is FDA Traceability Rule Impact and Compliance, and today's special guest is Radojka Barisiki. Welcome. It's not the first time you've been presented before, but it's nice to have you back, Radojka. Welcome.
Thank you.
I always ask guests, where are you joining us from today, Radojka?
I am from California, sunny California, USA.
Oh, it's not fair. Ladies and gentlemen, it's not fair. It's from California in the sun. Where are you from, guys? Tell us in the sidebar. Elaine from Missouri, John from Toledo, Bev's from California, maybe a neighbor. It's only small California, isn't it? James from Augusta, Georgia. Wayne, southeastern Pennsylvania. Genevieve from Philippines. Right, that's enough shout outs. Welcome everybody. Great to have you along. I'm going to play the sponsor ads now and then we'll be back for the presentation shortly. Just bear with me. Here we go. See you in 2 minutes. Okay, I'll be back for the Q&A later. For now, I'll hand you over to Radojka.
Awesome. Well, welcome to the webinar, Traceability Rule. It's quite early here in California. It's 7 a.m. So I know we have a lot of people from all over the world. So I'm pretty sure the time difference, it's quite a bit. So from wherever you are, I hope that you get a lot from this presentation today. So why are we here? So the FDA has determined through time and through a lot of data that they have had that the current procedures for traceability are not really working. We have had a long history, especially after the 2000s, with Peanut Corporation of America. That was a huge one, late 2000s. And in the produce arena, in 2006, we have a recall for spinach. We have had several recalls for lettuce, and also we have had a lot of recalls for cantaloupe. And one of the things that they found out is that in a lot of the cases, especially for these high-risk foods, it was taking too long to find the source. It was taking sometimes average of 35 days to actually get information on the source and prevent the source. So because of that, they decided that it was time to review the recall procedures. It was time to actually include a new regulation to provide the information or allow for the information access to be swiftly to them. So that's why we're here. So in 2022, they introduced the regulation into the 21 CFR, which is the Code of Federal Regulations here in the US. Is the book that holds all the regulations from the federal level, and 21, it's the book that actually holds the food and drug regulations here in the US. So they introduced that, and it was within 15 days, it was published, and it came into effect on January 1, 2023. Now, the interesting thing for these, it is that because the FDA understands that not everyone is prepared, not everyone that is covered is prepared for this kind of traceability, they are providing the industry with up to 3 years to prepare. So the regulation is on effect. So everybody that is covered should be building right now, if they don't have already a traceability program or a traceability plan that conforms with the regulation. However, the inspectors are not going to be enforcing the review of the traceability plan and programs and processes and procedures until January 2026. So take that date into account, so you guys understand when the actual regulation is going to be enforced versus when it actually came on effect. So who is covered by the food traceability? So the FDA has created what they call the food traceability list. So the food traceability list contain, as it says, all the foods that are covered under the rule. And as you can see, the list is extensive. It covers from cheeses to all the way to ready-to-eat deli salads. And the reason why these foods made it to the list is because when they did a thorough analysis of the recalls over time, and then they determined which foods were the highest risk in terms of the recalls. And based on that, they decided to provide or build this list. Now, this list is going to be reviewed every 5 years. And if there might be in the 5 years, some of them that may come up, some of them, or foods that might be added. So just keep yourself updated on the FDA website. Again, this was generated in 2022. So when the time comes about 2027, they'll do more and less a review of the list and publish a new list. So be sure that you are connected to the alert system for the FDA, because as I mentioned before, there might be foods that are added. There might be foods that if they show a good trend in terms of recall, meaning that the recalls cases or incidents have diminished, they will take that out of the list. So if you want to know what the descriptions are for each of these groups, go to the FDA website, fda.gov, and look at the traceability lists. They changed the website, so you're not gonna, the first page that you're gonna land to, it's not going to be the food page. You have to get to it. So if you go to the bottom corner of the website, you can find the food tab or the food link. Click on that and then do a search, food traceability, and it will take you, they give you provide you a link with the more information about the food traceability list and what do they mean by nut butters, what is included in fresh vegetables. Okay, so that way you have an idea what they are looking at. And throughout this webinar, I'm going to be talking at the end towards the exemptions that they have from the regulation. But again, this is a webinar, so if you want to learn more about the traceability rule, you will have to either go to the website, read the regulation, or of course you can contact me, ask questions at the end of this webinar, or also contact me when through LinkedIn or other means that I will provide later on. So traceability. So the FDA has defined the traceability as the event of basically looking at the product from the time the raw materials are received to the time that it's processed and to the time that it's shipped. So what we traditionally know as a one step back, one step forward, it is actually what traceability has been defined as. However, they also recognize that one step back, one step forward is not enough. So now they have extended the traceability to look beyond the receiving and the shipping. So at some point, and we're going to talk about these when we talk about the critical tracking events, there are certain areas in the supply chain that they're going to look at when it comes to the documentation and record keeping. So keep that in mind, that traditionally we said one step back, one step forward, and that's still kept within the FDA definition, but now they look holistically to that step forward and that step back. So now they're linking the entire supply chain. And the reason why they did that is because they saw there was a gap into that process. So there is a traceability lot code that has been defined, and it's nothing different than what you might have. It's just an alphanumeric identification of either the materials that you're receiving or how the food is processed if you're doing manufacturing, and that lot might change, and then you assign to the finished product or to the item that you're shipping a alphanumeric identification number that is unique to that particular batch or to that particular product that you make at a particular date. Nothing different than that. The only difference is that this traceability lot code is only required or is key in 3 of the CTEs, so the critical tracking events, and I'm going to be defining that in a few slides. But the critical tracking events that require a traceability lot code documented on the KDEs are the first land receiver that has to do with anything regarding of products of the sea. So fish and any product that is coming out of the sea, that person at the port or that entity that receives that and then takes it to either distribution or further process, they have the responsibility to assign a traceability lot code, again, that is unique to that items that they're receiving per batch that they receive, and that needs to be going out on the KDEs. The other one that is required to apply this traceability lot code, or that will be requested for that traceability lot code in a specific, is what we call the initial packer. So these are the people, and again, I'm going to redefine that in a few, that when a raw agricultural commodity is harvested, then they might have a space or send it to a packer. That initial packer of the raw agricultural commodity that is not your first land receiver, it's responsible for this traceability lot code. And then the next one is a process that they call transformation, which we know traditionally as being the manufacturing, processing. That is the other entity that are required to have this special traceability load code. Now, does this mean that if I am not the first land receiver, the initial packer for the raw agricultural commodity, or the transformation CTE, I don't have to have lots? No, doesn't mean that. It means that these 3 CTEs are primarily responsible for that traceability load code. And they need to have that in their records and paperwork. But they're still going to work with the lot numbers that other people send to them throughout the supply chain. Because otherwise, how can we link one process to another, right? So everybody has to have a load code. They can call it a load code, but the traceability, the formal traceability load code, again, it goes to the first land receiver, to the initial packer for the raw agricultural commodity, and for the transformation CTE. So this is how the FDA sees the traditional supply chain. You will have a farm, of course. A farm could be anything that has to do with raising the animal or growing the food. Then you are going to have harvesting, cooling, initial pack for the raw agricultural commodity, transformation, distribution, retail. And then you're going to have on the sea side, your fishing vessel, and then your first land receiver. These, along with ingredients, can also go to a transformation step. So this is a traditional, or how the FDA sees the supply chain from a holistic standpoint. So critical tracking events are those steps in the supply chain that I just showed that the FDA consider critical in order to do the traceability. So they are not all of them in the supply chain. So let's just take a look at what they have defined as a critical event. So harvesting has been identified as a critical tracking event. And it is the action of taking the food, whether if you're growing it, out of the field or the farm, if the animal goes into now to be consumed. Cooling is the process that in some cases the raw agricultural commodities might follow before they get to the initial packing. So again, this is a tracking event or a step in the supply chain that, accordingly to the FDA, is essential for traceability. Your initial packer, it's the packer that, or the person or the entity that will receive the raw agricultural commodity, whether it's the fresh vegetables or the fruit, and will put it in a packet, and that can either go directly to the grocery stores, it can go to a restaurant, or it can go to, in some cases, a processor. So again, this is just another step that has been identified as critical in order to perform traceability of foods. The first land receiver is that entity, whether it's at the port area or close to the port, that will receive the fish or the seafood coming out of the sea. Okay, this is not the aquaculture part of it. It's the entity that just receives the food coming out of the actual sea. Transformation, as I mentioned earlier, is the process of transforming raw materials into a finished product. We call it manufacturing, we call it processing. Again, this is another of the steps that they have identified as being it's essential for traceability. So in the distribution process, so if you saw, again, the slide where I showed the entire supply chain, there is a step of distribution. In the distribution process, they have divided it into two critical steps. One is the receiving of the materials, right, which is the act of basically bringing the materials in and then getting it to either further process, or actually if you're shipping directly from the initial packer or the field to the grocery store or to the restaurants, then it's going to be that process of taking that from the supplier and into the process that you have. So again, this is essential. And then shipping is that other part of the distribution where you basically take the product that you have, if you're transforming it, or if you are harvesting, or if you are actually packing it, and you take it to, or holding it and you take it to the next route or to your customers. Now, each of these critical tracking events have records that are required to be kept. And those records and documentation is called the key data elements. Okay, so it's when you hear the word from the regulators or you see it on the regulation, key data elements, all it means is documentation and records. Remember, for everything that you do, there has to be a record that is generated. And in some cases, all of this documentation that you are required can be part of your bill of lading, okay, for example, or it can be attached to your shipping documents. One of the things that you need to take account into the key data elements, that there is a lot of documentation that will be required, a lot of records, and each of the CTEs have records that they need to keep at the site, and some of them will be sent to the next step in the process. It is an extensive list, so I have not provided that here. I will not be talking in detail of what is required for each CTE. What I would tell you is that you can go again to the FDA.gov and that food section. When you get to the traceability rule, they have done a good job with a PDF that explains exactly what key data elements you would have and or need to have, and which ones you need to keep and which ones you need to provide. The other requirement is the food traceability plan. So basically, you have to have a document that explains in detail how you perform your traceability. So you need to have a person that is responsible for the food traceability plan, a person that understands your traceability program. This person has to be competent and, again, understand how the food is traced. You also need to describe the methods that you use to trace these products throughout the supply chain. And then, of course, you need to have all these activities documented, as I mentioned earlier. So you're going to generate a lot of records during this process. So be sure that you include responsibilities, methods, documentation, corrective actions. What kind of corrective actions do you have if something is to fail in your traceability process? And very important, and if you are GFSI certified and you comply with other regulations, such as the preventive controls for human foods, you need to test your traceability at a minimum once a year. I recommend doing it maybe twice because a lot of things can change in 6 months. But again, the minimum required is once a year. And again, the records that you need to keep, they need to be kept for at least 12 months from the time the food was shipped and in order to be traced, or the food was received in order to be traced. So you need to keep that record for at least 12 months. They're going to be open to inspection when the inspector goes to your facilities and requests you for traceability proof. So be sure that you have those accessible. You can have electronic records. You can have hard copies. It's up to you. How do you want to keep these and how do you want to present these? Just be sure that if you do electronic records that you review the 21 CFR 11 because the inspectors guide themselves through those guidelines or those requirements in that part of the regulation to be sure that records, electronic records are valid. They need to have some sort of traceability of who was signing off on the documentation, if there is a verification process that you're including in the documentation, and they have other requirements that you need to meet. So be sure that you look at 21 CFR 11. One of the things that you need to know about the records is that, again, they have to be accessible. So if you have them in electronic form, you have to be sure that that electronic system doesn't fail you when the inspector shows up. In my experience, Murphy Law works very well. So be sure that you have your backups when the inspectors show up, because again, upon request, you need to have those available. In some cases, if the records are kept off-site, they will give you a 24-hour process to retrieve them, but you have to remember that in the event that you are on a recall process and they're coming to investigate and look at your traceability records for them to find the source, 24 hours is a lot in a recall process. So be sure that you keep your documents, if you're going to keep them as a hard copy, on site. Any electronic records that are readily accessible, they consider them on-site storage. Now, one thing that they have identified that it could be very helpful for them when they do these investigations during a recall is what they call the sortable spreadsheet. And this actually is a document that they are going to require for you to have it electronically, because it allows them to basically sort through the lot numbers that they consider they need to be looking at. And basically, this is a Excel spreadsheet that's going to have information about the food that is in the traceability list, the lot numbers associated with that particular batch, and then all the information that is required in terms of where the product went and who was your supplier. Okay. And again, if they are looking or investigating the recall of a particular product that has a particular lot number, then that should be reflected on the sortable spreadsheet. Another thing that you need to have there is the lot numbers for the incoming materials. Again, if you are an initial packer, that will be information or some information that you're going to have on that sortable spreadsheet that is required from, let's say, the cooling process. Also, when we are talking about farming, one of the things that information that is key for them is to have the location of the area where the product was farmed. So that can be kept by the farm. It doesn't have to be provided by the farm. But if they have to go all the way to the farm, they need the exact location where the product was harvested from. Okay? So the material was harvested from. So having a map of the lot, sometimes here in the US, most of the time you have acres and acres and acres of land. So having the map of the acreage with the coordination or the coordinates for that particular lot that was harvested and went into further steps in the supply chain is very helpful, okay? Because when we talk about farming, There is a lot of things that are associated. They need to understand what was the risk and what are the corrective actions to actually improve the process so the recall potentially do not happen again. So within 50, 100 acres, 300 acres of land, you're going to have a lot of variability, right? Soil might change from 1 acre to another. The irrigation system might be the same, but water conditions might change. It all depends on how things are located. So the coordinates to pinpoint the area is very important for them to assess risks. So what are the exemptions for these? So farms are exempted, except that they have to keep this information on hand because they will be traceability, especially if it's a fresh produce to the farm. And they need to provide this information about the location of the harvesting area. Farm packed food. So if the farmer is packing the food as they are being harvested, like we see here in the picture, that is exempt. Foods rarely consumed raw, so like zucchini, eggplant, these vegetables that we cook, we don't consume them as is, are exempt. Raw commingled foods, they are exempt, and there are certain requirements for that exemption. Again, I'm not going to extend too much on these because there is a lot to cover, and you can go to the FDA.gov if let's say that you're making commingled vegetables, right? Oh, what is the exemption for me? Processed produce. So if you have, for example, spinach that is going to receive a kill step. Let's say that you have a canning process for spinach, then that canning process is exempt because you're already applying a kill step for the biological hazards in this case. That is exempt. Treated shell eggs. So there has been regulations already regarding shell eggs here in the US, and there has been processes such as pasteurization of shell eggs that have been already approved. So if your farm or your entity is doing already this process that allows the 5 log reduction of salmonella in eggs, because that's your biological hazard that is of most concern, then you can actually be exempted. Changing the food. So, for example, papaya is part of the traceability list, but in some cases we don't consume that as is. Yes, you can go to the grocery store, buy the papaya and consume it as is. So that papaya in the grocery store as is part of the traceability food list. But in some cases, some companies will take the fresh fruit and apply, let's say, a drying process. And that changed the condition now from the papaya as is to a dry papaya. And even though the drying process might not be used as a kill step, it falls off the food traceability list as it is described, and therefore that there is an exemption. The other thing is when we take the food from the traceability list and then we change again through freezing the condition from fresh to now it's frozen. And even though freeze drying is not considered a kill step, accordingly to the FDA, that actually changed the state from fresh to frozen now of the food and makes them fall out of the food traceability list. So that is not covered. A multi-ingredient food, and here we're seeing some peanut butter cups. Peanut butter, it's part of the food traceability list, but when added to a multi-ingredient food, it might change now. It changes now the traceability concept that they have by themselves, and therefore it's not part. The food itself, not the peanut butter, but the food itself is not part of the traceability list, and therefore it is not covered. A fishing vessel is exempt. There is a particular requirement for this exemption. Bivalve, mollusk, and shellfish are exempt. USDA regulated foods are exempt. The retail food establishments and restaurants are exempt. Retail food establishments are your grocery stores, and restaurant purchasing from the farm, directly from the farm, are exempt. Purchasing from the retail food establishment. So let's say that a grocery store sells to the restaurant, then that is exempt as well. Transporters, so your carriers, are exempt. Food for charity functions is exempt. Food for personal consumption is exempt. Food for school programs, Holden food for others is exempt. And of course, food for research, because it's not going to be consumed, is exempt. Now, one of the things that the regulation talks about on these exemptions in some cases is that you have to have, and again, it's case by case, you have to have written agreements with the next step in the supply chain. So for example, let's say that you're looking at an exemption because you are just going to be, let's say, holding the food, but and you're not going to be applying a kill step, but the next step in the supply chain will apply the kill step. Then that next step and you need to have a written agreement that says, yes, I am the processor, or I'm in the transformation step that is going to apply that kill step, and this is how I'm going to do it, and both parties sign it, and you, the person that is holding the food and is going to send it as is to the next step, need to keep that agreement, as well, of course, as the people that are going to apply the kill step. Again, if you are in this situation, I worked in the juice industry, and even though citrus juices, for example, are not part, or citrus it's not part of the food traceability list, I can tell you that by law, we couldn't send any raw juice, and I work with a big supplier here in California. We couldn't send raw juice to any entity that was going to use it unless we had a written agreement. So written agreements work to say, yes, by law, I'm bound now to do the kill step. And my recommendation to you is that you work with legal counsels to develop these agreements, because there is a lot of regulatory weight that goes into these agreements. If by any chance your customer, which is the next step in the supply chain, fails to do that kill step, it can have consequences for both parties, and you need to be protected, okay? Now, there is a cool tool that they have created in the FDA website, and it's called the exemption tool. And you basically go in there and just look at the different tabs, pick the one that you fall into or is closest to you, and then you follow the different prompts that they're going to ask you questions. Do you do these? You don't do these? If it's yes or no, then they'll continue guiding you, and then at the end, it will give you an answer whether you're covered or not. In that way, you have a better idea on what to do next. So how to be in compliance? Well, first of all, you need to know if you are in the food traceability list. And if you are in the food traceability list, what CTE corresponds to you? Where are you at in that CTE? Then based on that critical tracking event ID, maybe you're the transformation, you will find the KDEs, and I explained to you how to do that. That corresponds to you, and you need to be sure that you have all your records. Of course, develop and implement a traceability plan. Training is very important. You're going to have key people at your organization that are going to be responsible for these KDEs, generating the KDEs, sending the KDEs. Be sure that you train people. If you are implementing new technology, people need to learn about the technology. Look for technological solutions. AI has been on a rampage lately, especially since early last year. It has been coming for a while. And I'm an advocate of technology. If it fits the purpose for us and it makes our lives easier, yes, sometimes we can actually look at the cost and say, it is costly, but we need to look long term. Is this something that is going to do a return of investment for us? And is it going to not only make us compliant, but it's going to make the inspection for the regulators easier, which means easy for us. Okay. And the FDA has encouraged throughout the process for people to come on board with technology because it makes their job easier than looking for a stack of paperwork, right? So again, tap onto technology, work with suppliers. This is not just like, I am my CTE, I am in my little bubble, I'm just gonna do what is required from me and forget if my suppliers do it or not. Work with your suppliers, because if your suppliers do not actually provide you with the information and the paperwork that you are required, and you don't worry about it, when the inspector comes to your facility, whether it's during a recall incident or a routine inspection, and they don't see that those KDEs that you are required to have from your suppliers, you're going to have most likely an issue. Okay. And it's going to be a legal issue. So be sure that you protect yourself against that incident. And then audit your system. Okay. Audit your system. Routinely, that traceability exercise is part of your audit. If you're GFSI certified, you most likely do internal audits, so that should be part of and is part of your auditing process. And then, of course, when you have your third parties coming to give you a certification, then you also have that system audited. So cover yourself through internal processes and with the third party provider. And then stay informed in your regulations. This regulation is live. And like I mentioned, the traceability list might change in 5 years, depending on how much data they gather from this process and how much of a risk other products might represent. And if the ones currently in the list do not represent based on the data risks, then they'll fall out of the list. So you need to be in constant review of not only this regulation, but also other regulations that may come on board later on. And that's it for the presentation. So thank you so much for listening to me. If you want to connect with me, here are this is my email. You also can find me on LinkedIn. I will do a lot of live videos on LinkedIn. As a matter of fact, this afternoon, I have another one. I'll be talking about food labeling, just a little bit snapshot of food labeling. So thank you so much for being here.
Thank you so much, Radojka. Let me just lose the slides and then we'll get on to the questions. And there are quite a few. In fact, today, 1,365 registered, 404 live right now. That's pretty good. Okay, so let's start with a question from Mary. As importers, what are the responsibilities related to the traceability rule? Is it the importer's responsibility to guarantee that the supplier is complying with this rule?
So yes, as an importer, you are responsible that the supplier complies with these rules. If one of your suppliers fall under the traceability rule, you need to be sure that you look at where or the food traceability list, where do they fall under? And if you're, let's say, bringing product from Mexico that is the fresh produce, like vegetables, then that definitely is in the food traceability list. And then you need to require all the KDEs from that supplier. Again, you need to look at the food traceability list and how you're bringing the food into the United States in order to be in compliance.
Yeah, just a small one. A few people have asked about, will the training video and recording and the slides be available? Yes, they will afterwards. You'll get a PDF. Question from Angie. Where can we find a template for the sortable Excel spreadsheet?
So there is not really a template available. it is up to you how you present the information. Like I said, if you do have just an Excel spreadsheet that you want to create with the key information that is needed, and again, you can find more information on the FDA website, that is perfectly fine. All they want to know is all they want to do is to say, okay, I'm calling from lots 1, 2, 3, and 4. This is what I'm going to be looking at on the Sortable spreadsheet. And you might have 2,000 entries in there. They don't want to look for 2,000 entries. They want to be able to sort it out, right? So a Excel spreadsheet works very well. There is software companies that I know of that are creating this kind of technology for you guys already in terms of traceability. And like I said, the FDA encourages you to do that. There is big companies such as Trace Grains that are already doing that. We're doing that before the traceability rule. And there's other small companies that have come on board. Again, I can give you that information if you send me an email or contact me through LinkedIn. I can refer you to some of the softwares.
Okay, thanks. Question from Bruce. Other than changing suppliers, what recourse would an operator have should a supplier not provide the data required?
So other than changing suppliers, what recourse will an operator have should a supplier not provide the data required? Fire them. Honestly speaking, they have to be on board. I'm going to be blunt with this. If your supplier is not cooperating with you, maybe that's not the best relationship you want to have at this time. So they might be long with you. My recommendation to you is to work with your suppliers. I'm pretty sure nobody wants to lose your business, but you also have to make a hard decision because you need to protect your business. So I'm speaking as a business person here. So work with your suppliers. That's just first next step. If they are resilient, they are reluctant, they don't want to put processes in place, then you need to start finding a new supplier. And as of now, you have a little bit than 2 years to do that.
Okay, thank you. Question from Samantha. Quite a long one. Exactly what does our supplier need to supply us? Does it need a specific format, a specific name, etc.? And does it need to be communicated in a specific way? Does a supplier need to be aware of the new rules, or can they be compliant without knowing? I.e., we may purchase from a supplier that doesn't ship to us directly.
Okay, so like I said, the documentation or the records required from your suppliers is explicit in the KDE section on the FDA.gov website. So go there. They have a PDF that has several tabs. It has the harvesting, the cooling, all of that. And it's very simple. Don't think that they're asking for anything that you don't already have. You now need to call it a KDE, basically. So to transition your documentation, your supplier needs to associate it with the KDE. They talk in the regulation that a lot of this information can be found on your bill of lading, like lot codes, right? So, or description of the product, quantity of the product is required in your documentation. So all of that comes on your bill of lading. Don't change the process. Just see what you currently have. So this is what I call do a gap assessment. See what you currently have on your documentation and how does that associate with your with the KDEs that you are required. And then based on that, work towards filling in the gaps if you have any gaps. Okay. If every supplier of yours should be at this point aware of the regulation. If they're not, then it's your responsibility to make them aware, and it's your responsibility to work with them to have the documentation. Again, I'm going to be blunt in here. We cannot say to the FDA when they show up, oh, I don't have the documentation because my supplier didn't have it. They urge people to work together. This is a supply chain. This is not just you, right? So they urge in their webinars, in everything that they have presented in the website, work with your suppliers, work with your suppliers, work with your suppliers. Work on this together. Basically, that's the message that they want to have. And if they don't ship directly to you, or they have a port, or let's say that they go from the UK and the port of entry, it's not directly the US, that transition needs to be documented. Maybe you have a warehouse, let's say in Canada, and then from Canada comes here. All of that needs to be documented as part of your traceability process. So I hope that answers your question.
Yeah, thank you. Question from Angie. What platforms should be used to collect pertinent info from suppliers upon receipt of products?
Again, they don't tell you use electronic, use paperwork. It is up to you what methods you use. It is easier, and they have recognized that it's easier for you to have electronic systems, use technology. It makes their life easier. It makes your life easier. So when it comes to a recall, I have been part of a recall, and I can tell you that having a technology available to you to trace all that product and bring it back on a timely manner, it's essential. So they don't recommend one platform on another. They're not going to do that. They did do a contest a couple of years ago or so, and there is a list of softwares. Again, the FMI actually have the list. I can provide that to you if you send me an email. I'll provide that to you. Again, this is something that was developed by FMI, and I can provide that to you because I got hand of that, and I can distribute.
Okay. Another question from Angie. Does each supplier need to provide us with their GLN number?
So if the GLN number is associated with the lot in itself, yes, you need to have that. Now, there is certain information that the FDA will not request, and it's considered private. They want to be sure that the confidentiality is kept. So in some cases, they might ask, well, what is the website for this particular supplier of yours? If you don't have like the detailed information of the address, and based on their system, they'll be able to sort that out. Okay. So again, they're not asking you to give them your trade secrets. They're just asking you to be cooperative and provide as much information as possible for them. Again, within the means of the regulation for them to trace back.
Okay, thank you. A question from Anand. Is there any time period to store the daily production check sheets, considering the product's shelf life, or like and year, 2 year, etc.?
So yeah, your records need to be kept at a minimum for 12 months on site. If you decide to do it longer because the shelf life of your product is longer, I would recommend you to do that. So maybe you have 18 months or 2 year shelf life on your product based on the process that you have. Yes, I recommend that. But the minimum is 12 months on site.
Okay. Let's have a look. Question from Brian. Is fresh fruit, if a fresh fruit is included in a product that is frozen as part of the manufacturing process and then baked by the store, does this fresh ingredient have to be tracked?
So yes, so that's going to be traced, right, for the incoming as part of the, if it's in the food traceability lot or list, it is going to be tracked. But once it receives that frozen process, it's going to fall out of the list, because if you talk about fresh vegetables, fresh fruit, okay, it's gonna fall out of the list. You still need to have some sort of traceability, right? They don't say, oh, well, now that it's not in the list, don't worry about lot codes, don't worry about anything, we don't care. Because the incident for the recall may happen well at the bakery. So now they need to go back and say, oh, did this come from the farm? This come from somebody that did the transformation of frozen. Where is this come from? Okay.
Yeah. Okay. Question from Deborah. Written agreement and about raw flour. The kill step is done by the consumers. So how to have this agreement? Is it enough to add this information to the product packages?
No, it's not enough. You need to have, like I said, a legal document that is written typically by your counsel. and that you both need to sign that agreement, and that needs to be kept on file. You cannot leave it to the consumer. You cannot leave it to your, somebody reading a label. It has to be very explicit, and it has to be, outlined in an agreement. Now, remember that when you apply for these exemptions, the FDA is going to require you for documentation. You cannot go with word to mouth, oh, I'm exempt to your supplier or your customer. They are going to require you to apply to that exemption, and then they're going to give you a written notice that you have been approved for the exemption.
Right. Question from Mohammed. Can you explain how blockchain records the data in value chain to facilitate traceability?
Again, if you're using blockchain, which is technology, the most advanced technology that we have out there, pretty much like considered in the same way as AI, something that is relatively new. It's all good, and they want you to have that kind of technology for the traceability. Now, you need to be able to speak to it. You will need to be able to explain that to it. The inspector, you have to remember that this technology is new for the industry relatively, and you are going to have inspectors that are new to the technology, so you're going to have to understand the technology very well for them to understand that you're doing the right thing and not to give you a 483 when they inspect you.
Yeah, makes sense. Question from Dustin. Will FDA require manufacturers to have a scannable lot code for distributors? I'm a large distributor, and the notion of keying in lot codes would be crippling to my business.
So with the FDA require manufacturers to have a scannable lot code for distribution. Again, if the lot code can be provided and you have already a system in place that allows for tracing that lot code, they're not asking you to change what you have. What they're asking you at this point is to assess what you currently have and if it meets the regulation. And as a distributor, what you're going to be worried about is the receiving part of it. So are your customers, right, the people that contract with you, providing you with the right KDEs when it comes to these particular items in the food traceability list? And the shipping part of it, are you providing now to your customers or their customers, because you might be just the middle person, with the information that they need based on the food traceability list, okay, and the shipping KDEs? My recommendation to you is go back, look at KDEs, the key data elements, what is for receiving, what is for shipping, and look at that food traceability list. Am I distributing something that is in the food traceability list, and what am I required from both ends? And do I already have it in place?
Okay. Michelle, use feta and blue cheese. We use feta and blue cheese in our dressings. We already use lot codes and tie them to the finished product. What else different do we need to do?
Same answer. If you already have a system in place, do not go out there and reinvent the wheel. If you have tested the system and it works for you, then don't reinvent the wheel. You just have to be sure, though, to go that extra mile and that the suppliers are providing you with the documentation that you need. Documentation and records is key when it comes to inspections. They base their outcomes of the inspection on evidence, just like an auditor does. So they're going to go and ask you, what are your KDEs for this blue cheese and this feta? Show me the KDEs from the past 3 months that you have received. And you're going to have to know, like, okay, what KDEs do I need? What do I need to show them? If you look like with a question mark on your face, they're going to go like, wait, you're not in compliance, and they're going to keep digging to see what's going on. So again, look at your current systems, what you have, do a gap assessment. And if everything falls into compliance, then go ahead and leave it as is. If there is a gap, close the gap and work with your suppliers.
Okay. Mohammed is asking, and I guess this is broader for all overseas companies, whenever I apply on the FDA, it asks local agent for registration. How can I resolve it because I am from Pakistan? So
so if you're having lack of information on the FDA, there is some companies that can work directly with you. Register Corp, it's a company that actually specializes of imports and FDA registration. So it's registercorp.com. I would recommend with you to start searching for that. They have ways of finding out information that you probably don't have in hand.
Okay. Desireth is asking, sometimes supplier doesn't provide enough product information at the package example used by dates. How important is it to receive this type of information?
Again, everything is driven in this regulation through the load code, and that is what you need. If the expiration date or the use by date is part of the load code, then it needs to be included in the package. Okay. Typically, the load code it's a scannable and it's an alphanumeric number, and you can see it. I don't have a package with me. Well, I have these. It's a sanitizer, but like it's included in these, right? It's scannable most of the time, and that's what it's going to go into your system. So associating that to your food, if that is already there, you don't need to do anything else. But if they're just giving you information that includes the use by date as part of their load code, and it's in the package as part of the traceability, then that needs to be there as well. Now, use by date, it's important when you do a recall, because that typically also is associated with the lots that you are applying. But again, if you only have the alphanumeric number, that should contain all that information, including the use by date.
Okay, got you. Anthony, if multiple lots come on a pallet of product, let's say apples, is each lot and quantity required to be segregated and documented?
So all of that will come on your bill of lading. So your bill of lading will have the quantity of product that they're sending you and the different lots that they have assigned to that particular shipment. Okay, so they are already separated for you in the document. Now, when you receive it as a whole, right? And so you might have a system that says, okay, I received, let's say, 20 pallets of apples or 20 crates of apple if they're coming from the field, and I'm going to assign it this lot number. So X, Y, and Z. That X, Y, and Z is going to be connected to that particular receiving documentation in your system. And when I pull information from that X, Y, and Z, it should show me the 5 or 6 lots that came on that truck. That's how it works.
Okay. We're getting there. A question from Horshell. In case my product is further transformed, does my responsibility stop at the next element of the supply chain?
So your responsibility as a transformation or processor or manufacturer is to provide the key data elements for the next step, which will be your part of the distribution, right? So let's say that you're going to a warehouse. When you ship the product, you're going to attach to the bill of lading the KDEs required for shipping, okay, which will become the receiving for them as well. So again, look at the supply chain as a whole. It doesn't stop with you. The KDEs, you have responsibilities as a transformation and as a processor to provide the right documentation for the next step in the process.
Yeah. Okay. Last couple of questions. Dora, if we sell meals received from restaurants, are we subject to the traceability rule?
I believe you will fall under one of the exemptions depending on your business. Remember that there is also an exemption by the size of the business, which is related to what they call qualified entities, and it's all based on their revenue. So again, go back to the website, go back to the regulation. The rule, it's called FISMA 204. That's how people are relating it to, but there is a particular portion of the 21 CFR that where the traceability rule is at, and the FDA website can guide you through that process.
Okay. A couple more questions related to that. Gabriella, tomatoes fresh are listed on the list. We received tomato paste and dehydrated. Does this rule apply to us?
Again, the tomato fresh now has been transformed into a paste, which goes through a lot of process and kill steps by regulation, especially if they can it. So at that point, it falls off the list as part of the transformation. Now, the transformer, which is not your case, will have to have KDEs provided by the fresh tomato portion of the supply chain, and they need to provide you with KDEs that saying that these are the lot numbers. They are, as a transformation process, holders of the trace load code, the TLC, so they need to provide that to you. So you need to be sure that you have that, because when the FDA makes a recall of that product, they're going to look at everything, where that product went. So, went to this company that now uses as a paste in the recipe to make ready-to-eat foods. Let's see what this product is. And they're going to look at your traceability, and they want to look at that trace load code.
Okay. Angie, we manufacture fermented vegetables and pickles. Are we subject to the rule?
Again, if it goes through a transformation process that ensures a kill step, most likely you fall off, as if not fresh.
All right, we've run over, but this is the last question then. So, Michelle, we are a manufacturer. Do we have to supply the distributor the lot of the raw material used in the finished product, or just our finished product lot code?
Again, that relates to the KDEs. You're going to, if you're a manufacturer, then that means that you're a transformation step. You're going to provide the KDEs corresponded to the transformation CTE or critical tracking event, and you need to have the KDEs from your suppliers, which will be correspond to you to the receiving KDEs.
Okay, that's it. We've run over. Brilliant, excellent presentation, and lots of questions answered. Very successful. So we had a lot of people online with us today, and I'm sure they've got a lot out of it. So thanks very much, Radojka.
Thank you.
I know you've got 2 more later in the year to do with us as well. So we look forward to that.
Awesome. Well, thank you so much again, and have a good evening, good afternoon, and good rest of your day for everyone.
You too. Thanks very much, Radojka.
All right.
Okay. Loaded your certificate in the sidebar. We'll be following up in an hour or so with the recording, slides, and certificate. And watch out for an email for next week's webinar, because they're coming in thick and fast. So enjoy the rest of your day. Have a great weekend. Take care. Bye-bye.
Thank you.